my channel, and this is the first video of 2021 and I am so excited. I hope all of you have been good. I want you to first subscribe to this channel, like, share, and I want you to comment down below because this year is gonna be like really mind-blowing. We're gonna learn so much, and I am here. I will teach you as much as I can. So I know we've had fun in December, we've had food, we've met people, but there's something I want us to remember. You know, this is a new year resolutions. People want to get babies, they want to have a good life, they want to have a healthy reproductive life, but we have to remember, as you're starting to try to get a baby, you must learn some few things about getting a baby. And are these people who have actually been trying for years and years and still haven't gotten, and this is another year and they want to try something new. So I want to talk about infertility, and I hope that all of you can call other people who have been struggling with this, because we've not forgotten you. We know it's a new year and we hope for the best, and I will show you how. Watch this video. So if you're having this problem of infertility and you have been given this diagnosis by your doctor, or you know that there is a problem with your reproductive health, or you know your partner has this problem with reproductive health, you might really want to watch this video, because I'm going to give you a few teeny little bits of what could be happening to you and what's the way forward, because this year surely there must be a change. And if you've not visited a gynecologist, or if you have not seen any doctor yet, then this is the right time to do it this January. So I'm going to help you through it. It's a journey. Sometimes things don't happen immediately, but you just have to be patient. It's not easy to be told also to wait. I know there's a lot of pressure from your relatives, from even within yourself or within your relationship, and there's a lot of strain when it comes to infertility, and a lot of depression and anxiety and all that. As in, I really understand you, and I really want to help you through this, because I know from what I have seen with my patients and even within my friends and just around me, you know, this has been happening a lot and you're not alone. So I just want to remind you that we're with you. I'm with you, Dr. K, and I will help you through this. So I'm gonna give you a few details on some things about infertility, for those who really don't know what infertility is. And first I'll start describing, so that you can know whether you're actually having a problem with your fertility or not. So if you have been trying for 1 year constantly with your partner, and you know you're not living away from each other, you've been trying for months, at least even 3 times, you give it like maybe around 3 times a week, you've been constantly trying and having penetrative sexual intercourse, and you haven't gotten a baby yet in 1 year, that's when we call then we realize there's a problem with your fertility, and that's literally the description of infertility. So if you're under 35, that's what we call infertility. But if you're above 35 years and in 6 months you still haven't gotten a baby, then we might give you special consideration, because we look at the time between 35 and about, like when you're going to get into menopause. We don't give it too much time, like a whole year, to wait and see whether you will get a baby or not. So within 6 months, if you have been constant with your partner and you have been trying through and nothing seems to come through, then we consider that as a problem with your fertility. So there's some things that can happen in your body that can cause you to have this problem in getting pregnant, and I'll start with the most common to the one that is least common. So I will start with the common things that people might have. If you have been trying for that 1 year and you've done all the tests, sometimes even within the first 3 months, even a normal couple that is considered generally fertile, they might not be able to conceive within 3 months, probably because of the time you're ovulating. If you have a regular period and you have regular intercourse, ideally within 3 months, that's when we give you, you can be able to get pregnant. But if you're a totally healthy couple, you have been tested for everything, your sperm count is good, and you have no issues with your body as a female, then 1 year sometimes can happen without getting a baby. So that might be completely, sometimes we do not know why, but as we continue, if you're completely healthy, then we give it another 6 months. At least with the first 2 years, most people will get pregnant as long as you're a totally healthy couple. But not that these other people who actually have some things, and I'll talk about the most common one, which is hormonal imbalance. If you're a female and you check yourself and you see that you do not have a regular period, that might mean that you might be having some anovulatory cycles. That means that your eggs are not being produced every time you have a period. So whenever you miss a period, it means you didn't have a normal cycle. So that means you didn't produce an egg, and that means you cannot get pregnant. So if you have irregular menses and you have no other issues, then we consider it as hormonal imbalance. So we try our best to track when you are ovulating, so that you can be able to ovulate, so that we can be able to tell you when to have sexual intercourse more often as compared to the other times. So that's the most common cause for most people. If you're able to regularize your periods, and not always that we will regularize it, but you might even just get pregnant whenever. It doesn't mean that you're not ovulating at all. You will still ovulate, but you just can't tell at which point you're ovulating. So such people, we tend to give you a kit so that you can be able to tell when you're ovulating, and then that kit helps you to have intercourse the time you should be ovulating. Another group of people who have something called polycystic ovarian syndrome or disease. The issue with infertility comes in because you do not have regular periods, because you have an ovulatory cycles, just like the one with hormonal imbalance. So the same thing happens, is that we don't know when you're ovulating, but yes, you ovulate, only that it might be less times in a year, and that will give you low chances of getting pregnant. Another group of people, and this is on the female side still, if you have any abnormality in your structure, for example, if you have fibroids. If you have fibroids in your uterus, you tend to have something called subfertility. And when I say that, it means that you can get pregnant, but sometimes you just don't keep that pregnancy up to term because there's that fibroid, and I've discussed it in another video. I'll refer you back to the fibroid video. The fibroid tends to compete for space, for the attachment for the placenta where your pregnancy should attach. So if it's there, your pregnancy will not attach. So, and will not attach properly. So you tend to get a lot of miscarriages if you have fibroids that are not managed the right way. So fibroids can be a reason why you're not even getting pregnant in the first place, because you probably have no attachment of the placenta or attachment of the fertilized egg. So it comes out, so you don't have you just don't get pregnant. So if you have fibroids, that could be another reason why you're having infertility. Another group of people who might have blockage of their tubes. So what happens is that when you produce an egg, it should be able to pass through your fallopian tubes, both of them, and then they go into your uterus. And then while they're in the fallopian tubes, if you have intercourse, then there is fertilization of the egg in the tubes. So if the tubes are blocked for one reason or another, either during surgery or infections, I talked about chlamydia and gonorrhea and other STIs that can cause blockage of your tubes, that can prevent pregnancy. And by the way, I want to tell you that not everybody has one singular problem. They might actually have maybe fibroids and blocked tubes all at the same time, or have PCOS, that's polycystic ovarian syndrome, together with fibroids or together with tubal blockage. So all those can happen all at the same time, but even single-handedly, they can also prevent pregnancy. So those are the common things that we find with women, but there are other abnormalities with the uterus. If you have maybe the uterus didn't form very well when you're a small baby, and you probably have what we call a biconjugate uterus. It's not the right shape, or you have two uteruses, for one reason or another, that can also pose a problem in getting you pregnant. If you have problems with your cervix, that can also cause problems with you getting pregnant. So any structural problem can cause infertility. So those are the most common causes of infertility in women. Rarely do we have any issues in terms of like an abnormal egg or whatever, but those are the main problems with the women. When it comes to the guy with infertility, and I want to remind you that fertility is not just one person, it's two people. So when we're looking for the reason why you're not both getting pregnant, we must also check the guy, because if the male partner is not there, then we will never tell, even as we treat the woman, that there's another problem on this side. So maybe we treated the fibroids and still you're not getting pregnant. Why? Maybe because the guy also has a problem. So the most common problem with the males is the fact that there is the sperms. If they are too low in terms of count, or there are too many abnormal ones, or there's just the environment around the sperms is not enough, it's not good, or they have tubal blockage. They also have tubal blockage, again, same reasons, either due to smoking, so many other things. And most of the times it's usually lifestyle for especially for guys. That might pose a problem with your fertility. So it's very important, and the point is that it's possible to get pregnant. Even if you have multiple reasons why you're not getting pregnant, we sort them out one at a time, and we do not sort it out only in the women, we also sort it out with the men as well. So this is not a problem for the woman. It's always good to remember that the man is also playing a very big role in fertility. So this is just in a nutshell, but later on I will create a video where I will go deeper into details on different kinds of people, because everyone has a special need. But what I would say is that we are able to treat most of these problems, but I will give you an example of if you have tubal blockage, we can do surgery, but tubal blockage is very tricky. Even if we do the surgery, if that tube heals, it might still heal with blockage. So tubal surgery has happened before, but the success rates are not as good as we want them to be. So if you have tubal blockage, I would really want you to, it's possible to get pregnant with one tube, so be patient, it will be fine. Just relax. Even stress can prevent fertility. So you just need to relax and take each day as it comes and each month as it comes, and it's a journey, as I said. But if both of them are blocked and you've already tried surgery, and I said surgery is not always successful for tubal blockage, then consider something called IVF. IVF is in vitro fertilization. I will discuss it further for those ones who really want to know about IVF, because it is also a feasible way of getting pregnant. So do not fret. In fact, I've had some patients, when you tell them about in vitro fertilization, they're scared. They do not want to have any artificial kind of anything being done on them. But if it's the only resort, then I think that would be the best thing to do for you. But if you're struggling with fertility, remember, it's a journey. It's not just you. We are treating you and your partner and the community at large. It's also about us being there for you, because as a medical fraternity, we really care about your fertility, because we know it's so important. For if you get a baby, that's the happiest thing, that it's one of the things that make us happy as obs and gyn team. So I really want to encourage you, don't lose hope, keep going. And by the way, sometimes miracles really do happen. You might not get a baby now, but by the time you're like, maybe you've waited for 6 years or 5 years, we've had people even getting twins or even triplets. Like, it comes. So don't lose hope. There's always hope for you. So talk to me, write down in the comment section. Try and reach me on my Instagram handle as Dr. K Muthembwa, on Facebook as Dr. K Official. talk to me about your infertility or fertility struggles. If you've had successes, I really want to share it with other people. So if you've had a success rate and you've had babies and you can, you know, really talk about it even in my channel, I'll really want you to be there so that you can encourage other people to also keep trying and don't lose hope. See you. Have a nice happy 2021.